People ask me sometimes about how to treat insomnia, and I'm so happy to hear that because I might be an expert on the subject because I live with someone who's really a terrible sleeper. Um, it doesn't happen all the time, but I'd say once every couple of weeks, there's a 2 or 3 day period in which she just won't go to sleep, like a kid. She wants to go to sleep, but her mind is buzzing. She's thinking about things. Sometimes she's not even thinking about things. It's just wide awake. And it's hard to sleep with somebody like that because they keep you awake. They're restless and that you can feel their buzz as you're trying to become unconscious. So I've tried many things, and I'm not saying that what works for me and my partner will work for you and your insomniac partner, but it's great to try. It's even you might not have this experience, but it's really difficult for people that can't sleep enough. They wake up tired, sometimes and cranky or irritable, and the next day seems like something they really don't want to go into because they didn't get enough rest. So it's always good for me to help my partner rest because life then is better for both of us. So I'm highly motivated to treat insomnia with Shiatsu. And anyone can do this. It's really simple. The technique I'm going to show you is something that any baby or cat or anyone who can crawl around on the floor can do. So let's see, Tara, what we can do. So can I ask you to lie down on your stomach with your head in this direction? Okay. So lots of things might work for insomnia, but I'm going to show you what often works for me with my partner and with other people too, with clients in my professional practice. Generally, my thought about this is bring attention, bring energy down away from this part. There are a few things that you can try for yourself if you happen to suffer from insomnia in general, which is don't overstimulate yourself as you move into the evening hours. Don't eat rich or difficult to digest foods too late at night. Don't watch overstimulating stuff on a screen, kung fu, multiple murder movies and people leaping around or things that involve great emotional tension, dramas that upset you. Probably we should all watch nothing or watch the lighthearted Disney cartoons, something like that. But anyway, avoid overstimulation. And it doesn't work, but ideally I'd be able just to subtract all the screens away from the person that I live with after 6 o'clock at night, and then we'd both sleep better. But in terms of crawling, touching your partner, we're going to start by making simple contact with the center of our partner's body, just leaning palm heels anywhere in the soft area of the back and starting to crawl around. Very simple. This is just general kind of crawling, not a defined technique. Relax, follow your partner's breath. Let them support you as you lean on them. Very simple. I'm just coming to the other side of my partner's spine. And leaning. And crawling. And my direction is down towards my partner's feet. So I'm going to keep crawling sideways, going down towards my partner's feet. Make sure, hang out, relax wherever it feels good to you and your partner. You can always ask your partner what feels good if you're in doubt. Or ask them to make some noise or groan or moan or grunt or say yes, some kind of verbal cue to help you know what's really good and effective for them. Of course, the best thing you could hear would be a snore. It means it's working for insomnia. But be patient. Lean into the big, sort of fleshy back of the thigh. This is a wonderful, safe target for you and The back of the thigh can support really all of your body weight without any risk. Going to come a little bit closer and lean across the back of the other thigh. And keep crawling down. Very simple transition. Bring your body around so both of your palms can lean into the back of your partner's thigh. Get very comfortable. And continue crawling. When we get to the knee, we're going to go very lightly. We don't want to push our partner's kneecaps into the floor. By the way, this can happen on a couch or on a bed, any surface that's soft enough for your partner. So kind of sliding over the knee, leaning then a little bit more into our partner's calves. It's a smaller area, so I might use a smaller part of myself, which means my thumbs in this case. Back of the ankle. And now very simple crawling with your palms and your partner's feet. No special technique, just lean in with your palm heels. Hang out, wiggle your hips a little bit. Very simple. Great. And just to finish this off, we're going to focus on a point that's very effective for getting people to pass out, which is what we want. And I'm going to show you, I think this is a good angle, right in the kind of fleshy center of this part of the foot, just underneath the ball of the foot here. So very easy to lean in with your thumbs. Get very comfortable. You can approach with your hands any way that you like. If this were a little bit tiring for you, for your thumbs, you could decide to use some other part of your hand, perhaps your knuckles, a loose fist, anything like this. And slow down. You might hang out here for a couple of minutes. Look at how your partner, your husband, your wife, your friend, your whoever is breathing at this point. Okay, and most important of all, now that they're snoring, lean back very gracefully and tiptoe out of the room so you don't wake them up.